All right. Assalamu alaikum, Arjuman. We are live in my group, Empowered Women, and welcome in my group. How are you doing today?
I'm good, Kiran, and Alhamdulillah, I'm doing very well. And thank you so much for inviting me.
Oh, it's my pleasure to have you on board because the one thing I wanted to tell my audience, she is my dearest, one of my dearest friend. So that she is a psychotherapist, and that is why I invited her that we have to discuss on autism. So a short of a, sort of a short brief, introduction, Arjuman, if you would like to share with my audience, so that would be great. So then we shall begin with, this autism discussion as well. Please go ahead.
My name is Arjuman Raza. I am a psychotherapist, hypnotherapist, Reiki and Silver specialist, IEP, and Orton Gillingham programmer, as well as a life coach. And I'm running my clinic named Help for Kids and Adults in South Africa. But this clinic is online, basically. So I'm taking more patients and more clients visually and virtually also. So I have a website, name is same, Arjuman Raza. And lots of people, they are coming from my own website, and lots of people, they know me from Imam Connect and from Bark and from Psychology Today. I'm in multiple platforms. They can reach me out.
Oh, that's amazing introduction. We shall begin with, as you know, that we have to discuss about autism. So first, if you just can explain a little bit about this problem, this issue about this autism, what is it, and how does this happen? Then some signs and symptoms about autism for my audience, so that would be great. And then we would further, go on with discussion and some questions as well. Please.
Okay, autism is basically a social disorder. In old ages we call it that's a lingual disorder or a communicating disorder, but now autism is a very vast. Why I'm saying this thing, because before they usually add the inability or dysfunction of speaking or speech dysfunctions, but now they introduces the social interaction, lack of social interaction, lack of eye contact, lack of abilities to understand those stuff. So this is autism. We or any child is facing these types of issue like flapping, rocking, or stimming. These issues, we call it that's symptoms of autism. Okay. And causes, if we are saying about causes of autism, so autism has a very huge spectrum. And the reason is because autism can be caused by genetics. Genetics is also a big culprit, especially the chromosomes of 2q, 7q, and 15qs. And if, for example, if I'm having anyone in my genes or in my inheritance that's suffering from autism, I might have a child that suffers from autism also. This is one reason. The second reason, that pregnancy complications. So for example, if I am about to deliver a baby and I'm having complications, or I will deliver the baby premature, preterm, especially near to 26 weeks, that's also a cause of autism. Okay, so autism, we divide autism into two parts. The first part is lack of development of neurons, and this is the part where we are having the pregnancy issues, or if the mother was taking so many drugs during the pregnancy, or malnutrition issues while the child was not getting the proper amount of nutrients while the child was inside the tummy. Or we also called it, so for example, these are the few contents, or we are having the some sorts of deficiencies, also some nutrients, because nutrients has the direct combinations and the connections with autism. As well as if the parent was staying near the motorway, near the gas stations, so the lead fumes also cause these issues. Or the biggest culprit right now is environment, and especially the screen. Because we should know that we are having the synapses between two neurons, and when those connections will damage, so the child cannot think properly and have lack of emotions, more fear, more anger. This is also a cause. And screen causes the synapses to damage and disconnected from two neurons.
Okay, if I ask you, Arjuman, like, at what age this issue, this autism issue can be diagnosed? Because this is also would be a sort of, parents' concern that, those symptoms would occur, and they can also, find out that, okay, now at this point of age that we need to be more alert that, yeah, we are having my child is having some sort of symptoms of autism, and definitely, they need to seek some help for psychotherapist or psychiatrist. So what do you think, what could be the age for this, to get diagnosed with autism, and some causes, as you mentioned, so then, like, for parents that which age normally, this problem occurs?
So for example, if the child is between 12 to 24 months, that is the best age to diagnose autism.
Okay.
So 12 to 24 months, between 1 year to second year. So this is the frame we are having now, as early as we can. But we do have patients who are coming in the later ages, like they were 17 and 18, and the parents are bringing those students also and those kids also, and they never have therapies before, and they never went on anything. So but if the child is showing you some of the symptoms at the age of 12, and so for example, if you're doing the role play and the child cannot do it, or if you see the child is not playing with other kids and he or she is alone sitting in the corner area, or not interacting with other people, or not having the eye contact with anyone else except the parents or except the family members. So these are the few symptoms. Or by the age of 24 months, the child is unable to speak, like if we are saying the 10 words should speak, they should speak 10 words, and the child is unable to speak those 10 words. Or if you're asking them to do some works, like for example, if I'm asking my child to pick that thing up for me, and the child is unable to understand that thing, so go for a pediatrician first. So peds will diagnose these stuff, they will go run some tests for you, and then you will move on from there.
So what you're saying, like, there is no certain age, that we can define that, yeah, at this particular age, a child can, suffer with autism, even though adults can also, they get suffered with this issue, as you just mentioned, adults or teenagers, they can also, come up with this problem. All right, if I ask you about because autism is a broad some sort of you can say issue, and it might have some different types or levels of autism. If you would like to share with us.
Yeah, sorry. Good question. Autism is a very big spectrum. So it has multiple things. And before, we used to divide autism into 7 parts. And we included those things like ADHD also with autism, and yes, dyslexia with autism, or slow learning disabilities with autism. We used to include those ones. But now they, according to ABA, or American Association of Psychology, they have removed those types of autism right now. Okay. They said autism is only one thing that has a huge spectrum, and they have divided into 3 parts. So the first part, we called it the highest part, severity of autism, a severe, then mild, and then moderate. So these are the things we are having right now. So 3 levels of autism: mild, moderate, and severe symptoms of autism. So these how we are moving.
All right, like if you can elaborate a little bit about these 3 levels, severity or some mild sort of autism, so then my viewers can understand more, but a little bit about it as well. A little more detail, if you can just share with us.
Mild autism, the child will easily learn those stuff that he is able to. We know this thing that as compared to female, male has because of X chromosome and Y chromosome, male has the higher chances of having autism and ADHD. And especially because of the testosterone hormones also, male child or male kids are having more risk of autism and ADHD. So if if the mother is coming to me and saying that my child is hyperactive and keep rocking the chair and not sitting for even for 1 minute and keep talking but not interacting, means that language is there, but the language is non-conversational language. So for example, if I'm talking to you and if I'm asking a question from you, so the child cannot answer me, but he's keep talking. So that's, we call it as a mild symptoms of autism. But once you will move on, so if we are going towards the moderate one, so it will be more enhanced. So these symptoms will be like lack of sleep will be also there, or sleep disturbance, or they are very choosy related to some textures or some foods. They don't like it at all. And sometimes they like the same type of a food a lot. So they are keep chewing, and they are very tactile, and they are having very olfactory issues. Like some smells, they will just react so quickly that they don't want it. Okay. Or some things or some color. So for example, if the child is wearing the pajamas and he always wants that pajama, he doesn't want to wear jeans or tracks or anything. So textures, they are more textile textures, smells, or voices. So sometimes they don't like voice, like if somebody else is playing any song or any sound, so they don't like it and they will react it, and they are having more meltdowns as compared to the one who's having the mild symptoms of autism. Okay, then the severe ones, while we are talking about the severe autism, they are having more mood issues. The severe autism is correlated with the bipolar ones. So sometimes they are very depressed, sometimes they are very manic. So these are the few things we are having. But instead of these three levels, severity levels, we are having one more thing. We call it high functioning autism.
Okay.
So it's not compulsory that autistic child will never understand anything. Okay. And we have few students or few kids who are having high functioning of autism. They are damn intelligent, very intelligent. And you will see in the history also, either it's Isaac Newton or Einstein or Charles Darwin, they're all suffering from the same issue. They were high functioning autism they were having. So autism, it's not like that. It's basically social disease, or how we cannot socially interact, or a part of your brain cannot interact with each other. So for example, if I'm having amygdala is a part of a brain that is responsible for fear, anger, and emotion. If I'm having any type of a damage in my amygdala, so that causes this issue also.
All right. If I ask you, like, suppose those autistic child, maybe people or autistic children, do you think that that also affect, person's social interactions and communication skills in the society? What do you think? What would be your thought on that?
Yeah, it will affect a lot. So for example, if I'm having any autistic child with me right now, so if I'm asking him anything, he won't be able to answer me unless after multiple therapies of ABA and occupational therapies and speech therapies, then I will train that child. So I will just give you an example. I'm having a child from last December, and now that child is he's 6 years old, and now he is able to answer me. Last time he answered 78 questions. So I'm counting each and every question, that how he's answering, either he's answering me or not. So yeah, it impacts especially the relationships and social surroundings, the schools, colleges, workplaces.
Suppose, what do you think that could be the common challenges, those autistic people or children they face, individually, if you just, mention some?
They cannot express their feelings. This is the biggest. So if they do not like something, they don't know how to express it. Sometimes they just cry and cry. So parents should know that what are their feelings now, how they're feeling right now. Or they do not know that how to say someone, especially if a child is there and if the child wants to say I love you to his mother, he cannot say. So they cannot express their feelings. That's a biggest issue they feel. And the second thing, that while they're having any hormone outburst or a spike of hormone, they cannot regulate those stuff also. So for example, if any other child, normal child, is having anger issues, he will be able to handle those things. But if an autistic child was facing the same issues, he could not.
So, do you think that, Arjuman, that this autism, can be treated or cured? Are there some therapies that, available for autism, if you can share with us?
Okay, autism cannot be cured because it's a
Oh,
permanent damages.
sure.
Okay,
Okay.
so autism can be managed by different things.
Mm-hmm.
So, for example, we are having 9 therapies related to autism. The
Mm-hmm.
very famous one is ABA therapy, applied
Mm-hmm.
behavior therapy. So that is the most common one that we use it right now.
Mm-hmm.
And as well as the speech therapy is very useful for them. Occupational therapy is very useful for them. And
Mm-hmm.
CBT is also very useful for these students. Or IEP, individualized educational program, is also very good for these people.
Mm-hmm.
So we can manage, but we cannot delete that stuff. Okay, so it's a
Mm-hmm.
permanent disorder. Although we are having right now in the research, we are having some of the new trends that can improve the symptoms of autism.
Mm-hmm.
So
Okay.
these are the things we are having right now in our hands.
Mm-hmm. Okay, now in regards for I think from the family side, what do you think that family can support in this issue for an autistic child? If someone in their family, how can the those autistic children or adults can get some support or help through their family side? What their family can do for them, if you can share.
Okay, the first part and the worst part is also that
Mm-hmm.
whenever we get to know that some child is suffering from autism, we usually blame parents.
Mm-hmm.
Okay, that because of the mother the child is having this issue, or because of the father the child is having this issue, and mother gave the devices or screen in a very early ages, that's why the child is having this issue. Mother was not taking care properly. So the first thing that the family can do it is stop blaming the parents, the first thing.
Mm-hmm.
Okay? The second thing that can improve or help an autistic child is
Mm-hmm.
give them a little bit time
Mm-hmm.
and start the therapies as soon as possible. So, for
Okay.
example, if I want my child, and if my child is having suffering from autism, and if I want my child to learn colors, so I will opt for the therapies as soon as possible.
Okay.
Okay. So
Mm-hmm.
once the child will come up with this issue, it will take maximum 2 to 3 sessions, and that child will learn what are the names of the colors and how to differentiate it. And we will provide the reward system, because the reward system is there was a psychologist named Skinner
Mm-hmm.
who introduces this ABA therapy, and he has explained the importance of reward system, especially in autistic child, in his
Okay.
ASD students.
Mm-hmm.
Yes. So
Mm.
that reward system, because we learn something by repeating something. And
Right.
for example, if I'm repeating how to drink water or how to write, I will learn that thing. Okay.
Mm-hmm. Mm-hmm.
But these people, they do not know that whatever they are learning, it's right or wrong.
Mm-hmm. Right.
So the reward system will explain them properly that the thing that you are learning right now, we like it, we are appreciating this thing, and that's why we are giving you the reward, and you have to repeat this behavior. Okay.
Mm-hmm.
So these are the few things that we usually teach parents, especially while they're coming for the autism therapy sessions or counseling sessions.
Mm-hmm. Okay, so what do you think that those autistic children, do they also have some problem? Do they find any problem in regards for their learning process, in their education process, in their study time? Do you think that do they suffer with some problems and some issues as well that we need to highlight?
Yeah, if the child is suffering from multiple issues with
Mm-hmm.
autism, so for example,
Mm-hmm.
if the child is having dyslexia with autism, or slow learner disabilities with autism, or ADHD with autism, that causes the difficulties in studies, especially. But
Mm-hmm.
normally, a child who's having only autistic problem or ASD issue, that child will never have any issues like that. But
Mm-hmm.
he will be more quiet. Maybe he will never learn inside the surrounding of the in class, and that
Mm-hmm.
child will learn alone better, or IEP will be more better option for that child.
Okay. And do you think some myths are also, around this autism issue, with you can unravel those issues, those myths around this autism illnesses? If there are some, so then you can share with us.
Okay, there are few medicines we recommend, especially if the child is having the anger issues or the hyperactivity or hypersensitivity issues,
Mm-hmm.
especially in autism. So we write some of them, but we never recommend under 10. So if the
Mm-hmm.
child is under 10, we never write those medications for any child. But yeah, after 10 years of the age, if the child is very hyperactive and the meltdowns are more than 6 a day,
Mm-hmm.
means then we consider giving the child medicines.
Mm-hmm.
Okay, this is the first. Second thing that related to the myths, we are having many.
Oh.
Some said that that's a evil eye. It's
Mm-hmm.
not a disease. Some says that it's because of some sorts of jinn and those are stuff, and they are having these things. In the old ages, the issue was there from day one, and they never accept that issue, and they just change it into a different forms and the different names. You will see it
Mm-hmm.
even in the community here in South Africa. We are having the, if you see any autistic child in black people, they say no, 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 it's a magic, it's a black magic. It's not a disease at all. And if you
Oh,
try to explain them,
yeah.
all parents know that their child is having some issue, and parents are the first one who can identify if the
Yeah.
child is having an issue. But
Mhm.
it takes time to accept this thing and to start doing something better for their child.
Mm.
So
Yeah. Okay. One important question for autistic, especially autistic patients or children or sort of adults. What do you think then? Because this is a proper illness, and like, do you think that they should seek help, from psychologist, psychotherapist, or psychiatrist? What do you think would be the best therapist would be, those autistic children should go to? What do you think? What, in your, opinion?
okay, depending on the child. So for example, if the child is very hyperactive, very aggressive, then I will ask them to go for the psychiatrist help, not
Okay.
for the psychologist.
Mm-hmm.
Okay, but
Mm-hmm.
if the child is very calm and slow and having the mild symptoms, then I will recommend them to go towards the psychologist.
Mm-hmm.
And but here we are having different types of psychologists.
Mm-hmm.
So if the child is having the issues related to academics, so I will recommend go to the educational psychologist. Or if the child is having the speech issues, so I will ask you to go for the speech therapist, or those different things once, or occupational therapist. We are having a different frame.
Mm-hmm.
But if you can get it one all whole in one, that's a therapist, psychotherapist, that's a trained for occupational therapies, IEP, speech therapies, as well as CBTs and ABA therapists. Go for that one if the child is having multiple issues.
Mm-hmm. So, if you can explain a little bit about this autism, is this autism related to certain issues, like, maybe a child would having some speech problem, or they would have some, anger management issues as well? So what do you think, an autistic child can have all these different issues or these different problems, traits as well together in autism?
Yeah, an autistic child can have multiple issues at the same time. The
Mm-hmm.
reason is because we are having our frontal prefrontal cortex and
Mm-hmm.
our brain. So
Mm-hmm.
our brain is controlling our learning system, the prefrontal cortex, the frontal area. So if
Okay.
the synapses, the connections is damaged between the frontal area and our amygdala, so
Mm-hmm.
amygdala is controlling your emotions.
Mm-hmm.
So emotions, if you're having these issues, the connection is damaged, so your child will never have emotional recognition. They will never understand what is a smiley face or sad face and those stuff, and when the parents are happy with them and when the parents are sad with them, or having the anger issues, multiple anger issues also, or we are having the posterior part of our brain. If those connections are missing, then the child will have multiple issues with learning, like academical issues, and the child will never able to learn how to do brushing and basic hygiene things like going to the toilet and changing the clothes. And so it's basic, all things are learning.
Oh, okay. All right. Last question. If I ask you, maybe second last, that like, do you think there is a link between autism and Asperger's? I hope that I'm just pronouncing this name properly. Asperger's syndrome. What is the difference between these two? Please, if you can explain.
Okay. In the older ages, they used to consider both things together. Okay. But right now, we separate those things. Asperger's syndrome, it's totally different as compared to autism. So if you're focusing, autism is basically the social surrounding issues. And but if we are having anything like, for example, just give me a second. Okay. So if we are having anything like developmental disorder, so I told you before, like when the child was inside the womb and he was having any sorts of developmental issues or pregnancy issues or drugs misuse, those things, young people with Asperger's syndrome have a difficult time relating issues. They also have the social behavior issues, social issues, behavior issues, and thinking issues. But it's a form of autism, not an autism itself.
My best colleague, she's a doctor herself, pediatrician, and she just commented here for you. So let me read it for you so that you can respond on it. Like, she was saying in the comment that many people come to me in the clinic with so-called speech delay, and are told that the child is autistic. But on getting the full history, the child is perfectly all right. But the parent either do not talk to the child because they're busy, or there's no one to talk to them, like grandparents. Therefore, misdiagnosis has to be avoided. There is always a fine line. So, what would be your thought on that, on this comment? Dr. Sheen is there, she commented.
Yeah, she's right, because there's a very fine line and the symptoms are very correlated to each other. So, for example, if the child is having only speech processing disorder or auditory processing disorder, or so, for example, the child cannot hear how he will say something. So if the child is having auditory processing disorder or ear issues or speech issues, that's also a symptoms, also this thing. Or if the child is having the ADHD or autism, that's also a very fine line related to these ones. So the symptoms with the ADHD child also cannot sit, autistic child also cannot sit. ADHD child cannot express, autistic child cannot express. ADHD child is also having the anger issues, the autistic child is also having the anger issues. So these are very common issues that we are having right now. And if parents are very reluctant to accept this issue, that if the child is suffering, because this A words, either if you're using the ADHD words or autism word, both A words are very dangerous for parents. In that case, if the child is coming, I'll ask them to go for the functional MRI first and go for the CARS test. CARS is a test that describes or explains properly or evaluate autistic child.
All right. Thank you so much, Dr. Shireen, to attend this session and for commenting on our live session. And now, in last, that if you can, advise parents, whose children are autistic, what advice would you like to give to them to, deal with their children in a better way?
Okay. There are a few therapy sessions you can provide it at home. and it's very useful. So for example, you can chunk those words down if you're giving them instructions. So for example, if I'm asking them that go eat food, instead of using the whole sentence, I'll say eat and food, only these two words. That will be helpful for them.
Oh.
Or make them routine. A proper routine will be very good for them. So I have one child, and I told, explain him that at before 5 o'clock you're not allowed to go in your grandma's house. Now at any cost, even though the grandmother is also calling him, and he said, no, I will not go until I'll wait for till 5 o'clock. So they have the time fixed inside their brain. So use it positively, and chunk your words specially, and use the reward system at home. These are the three advices I can give it to the parents of autistic child.
Thanks a lot, Arjuman. I would say thanks a lot for coming and for the brief discussion on autism issue and for giving those beautiful advices. So I would invite you again some other time as well to discuss a lot more issues, because there are a lot more issues that people they do not know. And then from my side, I always try to shed some light on these issues and try to solve parents' problem, people's problem in the society, and that's the a little bit effort you shall say that I'm doing from my side. So thanks a lot for coming today. You have a lovely day. Inshallah, gonna see you soon and invite you soon again. Bye bye from my side.
Bye.